So Kyle, what advice do you have for someone whose oncologist might be very against surgery, but the individual believes they're a candidate? Should they get a second opinion?
You should, because this is a situation where, as I've said in other contexts, reasonable minds may differ. There's not a clear right answer to a lot of this stuff. And people who are apprehensive to do it because they haven't had a lot of experience with it are probably right to be apprehensive. You need a real team that's come together, that's done this before. And even then, do we know for sure that it's the best idea? We don't know yet. We're doing it, and these are in research centers usually that are able to follow these patients over time, put together the data, make an assessment. Was this a good decision?
In highly selected patients.
Yeah.
People who are the super fits, the super youngs, the super limited disease sites.
Yeah. So I think the second opinion absolutely makes sense. And then, if you're at a center that does these kinds of surgeries, but they're not sure you're a great candidate, meaning maybe the tumor is too spread, maybe the physical activity needs to be better, you can, take those sentiments to another group and say, hey, they thought this, what do you think? And then, professionals can talk. So I think the more people do that, probably the faster the field's going to move and how we cumulatively view this situation, because it is brand new. So the second opinion is absolutely critical, and don't feel guilty about that. We don't mind as providers if someone chooses someone else's recommendation over ours. Everyone's just doing their best.
Mm-hmm.
We're all trying to help the patient the best we can. We're all just people in this together. And ultimately, it's the patient that has to live with the consequences of their decisions, whether they decide to do a surgery or not.
Mm-hmm.
There's consequences to both. And no one has to experience that other than you. And we get that. We get that. It doesn't bother us. So that's what I would recommend.
We hope you liked this video. To support cancer research and get clear expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.